Hello.
Hi.
It's nice to see you again, Mrs. Edwards.
Yeah,
Hi.
hi, doctor.
So the nurse told me you were having chest pain.
I am. It's like a dull pain right here. It's scared me, of course, because it's reminiscent of when I had my heart attack.
Same kind of pain.
Same kind of pain. I've had it for about a day.
Okay.
And if I get up and move around, it gets worse. And if I, sit down, then it's better. So I'm really worried.
Okay. So when did this pain start?
Let's see. It's around 2 o'clock. Probably in the morning yesterday, maybe around 7 in the morning. Yeah.
When you were
just getting up. Just waking up.
Just started
yeah.
when you woke up.
Right.
And what does it feel like?
Pressure, like last time.
Mm-hmm.
Like pressure here,
Does it spread anywhere? Does it go to your arms or your back or your neck?
Because it's like last time, I'm thinking like last time, and I'm thinking maybe here, but it really isn't. It's just still right here.
Doesn't radiate, but it sounds like it gets worse with any kind of activity.
Right.
And it gets better when you're at rest.
That's true, yes.
Are you having any pain right now while we're talking?
No. I'm just scared.
Okay.
Yeah.
Any shortness of breath, any other symptoms? Cough, fever?
Not before yesterday morning, no. I've been feeling really good since my history, isn't great, but I've been feeling really good.
No leg swelling or leg pain?
No, and I'm careful to look, and, I am aware, but no, I haven't had that.
Good.
Yeah.
Good. And no belly pain, no new back pain?
Nope, just this, and I don't want another heart attack, It's just, I don't know what to do.
Okay.
What can we do?
Well, I'm going to examine you first, and then we should get an
Okay.
EKG and send some labs. But I'm
Right.
thinking, since this pain sounds like the pain you were having with your heart attack a couple of years ago,
Right.
We may want to get you over to the ER for them to have a closer look at you.
Oh,
Maybe get a cardiologist involved like last time.
Oh, well, that's probably the best thing.
If I recall, 2 years ago, so you had a heart attack. It involved the front part of the heart, and you had 2 stents placed. Is that right?
Yeah.
Right.
Yeah. And,
Let me review.
that wasn't like a full fix on the heart. That was good. I was happy with that.
And you, if I recall, you were doing cardiac rehab after that.
Yeah,
Right.
About 3 times a week for about 4 months.
Mm-hmm.
Yeah, and I've kept up, the walking,
All right. Well, let's go through your history here. We talked about you had the heart attack. You've got high blood pressure. Any changes in your medicines with your cardiologist?
No, the same 2 pills a day. Yeah.
Okay. And that's the metoprolol. You're taking metoprolol 25 milligrams twice a day?
Mm-hmm. Yeah.
Good.
Yeah.
Okay. Diabetes. Are you still on your diabetes medicines?
I am, and I do watch my food. I'm pretty careful. I've been frightened into, paying attention.
Good.
I do.
Good.
Yeah.
Okay. So that's the glipizide and the metformin. You're not taking insulin yet?
No.
Okay.
No. Like I said, I've been frightened into it. I'm pretty careful.
You checking your blood sugars?
Yes. Yes, I have.
How many times a day?
3 times a day. I have the finger here to show it.
Yeah, no,
Bad finger.
What have they been, your blood sugars?
About 110. That's pretty good, I think.
Yeah, that's excellent. That's right where I would like it to be.
Yeah, about 110.
Excellent, good. And you had gout and you were taking allopurinol for a while. Are you still taking that?
No.
Okay.
No,
And you
no,
haven't
not
had any joint flaring in the last few years, if I recall?
Thank goodness.
Good.
Yeah, that was the worst almost.
All right. And a while ago you had a leg infection. You had cellulitis, if I recall, on the right leg.
Yeah.
That's resolved now.
Yes, it is.
Good.
Yeah.
Okay.
Thanks to you.
If I recall, you were allergic to the sulfa medicine that we started, and then we switched you to the other medicine, and you did fine.
Mm-hmm.
All right.
Yep.
And sulfa is your only medication allergy, if I recall.
Yeah, except I don't like codeine, It makes me kind of nauseous, but yeah, that's the only real allergy I have. Yeah.
You still living with Bob?
Yeah, I'm still.
Okay.
I still have company at home. Yeah.
Good. He's treating you okay?
Yeah, pretty good. You know, you have to kind of, weed out what's yours and what's his. But other
Sure.
than that, it's
But
fine.
you
Yeah.
feel safe at home.
I do feel safe.
All
Yes,
right,
I do
good.
feel safe.
And
Yeah.
you never smoked, if I recall.
No.
Okay.
Never did.
And how about alcohol? You're drinking once or twice
Sure,
a
a
week?
little bit, but with the diabetes, I have to be careful.
Good.
Yeah.
Good. Okay. Well, let's examine you here, and then I want to see an EKG.
Okay.
All right. So your skin is warm and pink. That's good. Your heart sounds totally normal.
Does it?
Mm-hmm. Your heart rate was 80 coming in. It's probably about 60 now. Deep breaths. No respiratory distress. And your lungs are nice and clear, so that's good. Let me feel your pulses here.
Yes. Sounds good.
Radial pulses are 2+, and your capillary refill is less than 2 seconds, so that's good. And let me see your legs here. So you've got about 1+ pitting edema of the legs, so mild.
Seems good to me.
Seems stable from the last time you were here. Okay. And the skin that I see is normal looking, no rashes.
Right. No rashes. No.
All right. And I don't see any jugular venous distension in the neck.
No.
Okay.
Pretty good.
Looks okay. So you got a normal physical exam, I would say.
All right.
I'm going to order an EKG. We'll have the phlebotomist come in to get some labs from you.
Okay.
But I'm going to also make a call over to the emergency department, and we should get you over there.
All right.
So hang tight.
Thank you.
Be right back.
Mhm.
Hi, this is Dr. Hurwitz to speak with the emergency physician, please. Hello, Dr. Smith. This is Dr. Hurwitz over at the clinic. Look, I have Cookie Edwards here in my clinic today. She's complaining of chest pain. So this is an 82-year-old female with a prior MI about 2 years ago. She has 2 stents in the LAD with cardiology over at your facility. She came in with chest pain for about 24 hours. She has inferior ST depression on EKG that's new compared to prior EKG. She's hypertensive at 190/68. Her heart rate's 72. She's setting 92% on room air. Afebrile, breathing normally. I don't hear any pulmonary edema. Her heart sounds are normal. She's well perfused. But I'm worried about unstable angina in this lady. So I gave her some aspirin. She's pain-free at the moment, hasn't needed any nitroglycerin, but I'm going to call EMS and have her transported by ambulance. Okay, great. All right, I appreciate it. Thanks a lot. Hi.
Hi. Yeah?
Well, I looked at your EKG.
Uh-huh.
And for the benefit of my scribe, I'll describe my findings. Okay, so there's some ST depression, 1 to 2 millimeters in leads 2, 3, and AVF. There's no ST elevation, but there's some T-wave inversion laterally. The rhythm is normal sinus, the rate is about 65, and QRS and PR intervals are normal, the axis is normal. Okay, so you've got signs of strain on your EKG.
Like more than after the heart attack?
Yeah,
Oh,
these are
my
new.
goodness.
So I compared today's EKG from one we got 6 months ago,
Uh-huh.
and these changes appear to be new. What I'd like to do is give you an aspirin tablet, and
Uh-oh, yeah, okay.
okay,
Yeah.
and then we'll have you go over to our emergency department. I want you to go by ambulance because I'm worried about these changes.
Oh my goodness. Well, I'm sure glad I came in.
I am too.
Yeah. Okay.
I am too.
All right. Thank you.
Alright. So on recheck, your physical exam is unchanged. Let's draw a troponin, which is the cardiac enzyme that I'm most concerned about. We'll also draw a CK and a CKMB, a complete metabolic panel, and a complete blood count.
Okay.
And then once those are drawn, we'll have the ambulance come pick you up and we'll send you off to the emergency department.
All right.
I've actually already spoken with Dr. Smith over at the emergency department, so they're waiting for you.
So he's the ER doctor.
He'll discuss things with the
Okay.
cardiologist if he
Yeah.
needs to,
Okay.
and they'll
Okay.
probably end up admitting you to the hospital today.
Oh my goodness.
You may need another angiogram, you may need some other tests.
Oh my goodness. Okay.
I'm glad you came in.
Yeah, me too. I'm
Stay
scared though.
put.
Yeah, thank you.
We'll get you some
Alright.
aspirin in just a second.
Okay.
And you're not having any pain right now, is that right?
I am not.
Okay,
No.
if you do, speak up and we'd give you some nitroglycerin if that were the case.
Okay. All right.
Alright. It's
Thank
nice
you.
to see you again.
Yeah.
She'll be by in a little bit.